lead toxicity. Got it. Okay. So without further ado, Kavita, can you focus on Amy and me and you, like 4 of us? Can you spotlight us? There you go. And on the side by side, can you spotlight me as well so I can introduce? Yeah, there you go. Thank you so much. Hello, everyone. Good morning. And I'm introducing you, Amy Schumann. And I will introduce you that Amy grew up in Florida and moved to Seattle in 1987. At the same time, Amy, I moved to United States from India too.
Oh,
Common there.
That's great. It was a good year.
It was a very good year. And she received her bachelor's degree from Florida State University and MSW from University of Washington, our own UW, with the focus on public policy and administration. Amy started public health, Seattle King County in '94, as a health educator in the family planning program. And over the years, she has worked in chronic diseases and injury prevention and communication before her most current position as a manager of lead and toxic program in the environmental health services. And she's very much interested in working to confront the historical and racial inequalities, which we see a lot being talked about these days. And it being this month being a Black History Month again too. Every day in the news, I've been seeing that. She's also had the opportunity to focus on preventing the childhood lead poisoning and toxic exposure. So what we are going to learn today from Amy is we are going to learn why testing for children for lead is important and when is testing recommended, and common sources of lead exposure and how to prevent lead poisoning at home. Okay, so those are the things that we are going to learn. And I had also forwarded you guys an article where our own Indian spices that we have gotten from India, like turmeric and other spices, how they've been loaded with lead and how children have been, without knowing, we've been eating that. And I'm seeing a lot as an early childhood teacher, a lot of speech delayed in children. And also being a pandemic year and also not being aware of what we are eating and what is there in our food and around our house. So welcome, Amy. Thank you so much for joining us today. Take it away from here. It's all yours.
Thank you for having me. I'm really glad you sent out that article. I have just a screenshot of it and would love to hear, we can talk about it a little more later after the presentation. I'd like to leave plenty of time for questions because it raises so many issues about the safety of our food and just where, lead is just a scary thing and it's really hard to know. So hopefully at the end of this, we'll just have a better idea of risk and what you can do. So let me share my screen.
We're very fortunate to have you because it just so happened that article came out and then you reached, Anish, Dr. Anish Dave reached out and I was like, yes, I need this. So, we were very fortunate that it all happened around the same time.
Yeah, that's great. Yes, Dr. Dave is an incredible champion. We've been working with him for 3 or 4 years now, and he's a rheumatologist, but he's very passionate about lead, and he's done so much to work with medical systems around trying to increase blood lead testing. He's just a remarkable person to have endless energy and time. I mean, he must be just like the busiest man in the world, but he
is. I wanted
always
to have
seems
him
to make time.
Yeah, he is.
Yeah. Yeah, he's wonderful. So, so my program is the Lead and Toxics program within Public Health Seattle and King County. It's housed within the Environmental Health Division
We
at
don't see
Public
your
Health.
screen. Are you sharing
Oh,
your
you
screen?
don't?
No.
Huh. That is weird because
Open your presentation and then share screen.
I did. Screen to share.
There. We can see it now. Perfect.
Okay. How's that? Can you just see one slide now?
Yes, we can.
Okay,
yes,
great.
That's
Okay. So we are in the Environmental Health Division. For the last 4 years, all of our funding has pretty much come from the Centers for Disease Control and Prevention through a grant through their Childhood Lead Poisoning Prevention Program. My position, and we have an educator consultant, Najma Dahir Abdullah, both of our positions are funded through Best Starts for Kids, and you all may remember that that was on the ballot in August as sort of a property tax levy, and that funding provides resources for different programs. So up until just this last, until January, all of our funding came from CDC except for our FTE, our positions. But starting in January, we're actually receiving Best Starts for Kids funding. So we're really excited about all of the new things that we're going to get to focus on with additional funding. So, oh, and basically the purpose of Best Starts for Kids is to give every child a chance to really full potential, to be as healthy as possible, and to support families in raising. That is Best Starts for Kids. So we really appreciate the support from that initiative. So toxics, we're just going to start with the basics. A toxic substance is something that can be poisonous or make you sick. And they can be in water, soil, dust, often in paint and other products. Asbestos is a toxic, and it used to be used a lot in insulation or vinyl tile, asbestos flooring. Mold can actually create toxins that can make people sick. Arsenic is something that is in treated wood products, and we actually have quite a bit of arsenic contamination in the South King County and Pierce County from the old Asarco smelter. I don't know if any of you have gone down to Ruston in Tacoma, but that was the site of an old copper smelter, and that deposited lead and arsenic into the soil for many, many years and is still being cleaned up. But we also see arsenic in like railroad ties or treated lumber can have arsenic. Soaps and lotions can have toxic substances that give them color or fragrance. Cleaning products can be toxic. We often, very familiar with the warning labels on those products. Flame retardants that are put in carpets or on furniture are toxic. And of course, pesticides are toxic for us. So we're all exposed to toxins, and the way that they get into the body through from all those products and sources we just looked at, they can be in the air. So air pollution, like particulate matter that we breathe from exhaust, from different types of industry. It can be in the soil, as we just talked about the Tacoma smelter plume that put lead and arsenic in the soil. It can be in our water, either contaminated groundwater, wells, or from the pipes themselves. Different products that we use can, like, just sitting on, the couch and breathing in the toxics. We can ingest from our food. So it's these 3 different routes of exposure: ingestion or eating, breathing, and contact with our skin. And then that results in exposures. So we all are exposed, but not everyone gets cancer or gets sick. And one of the reasons why some people get sick and some do not is risk factors. So a risk factor is any attribute, characteristic, or exposure of an individual that increases the likelihood of developing a disease or injury. And so when we talk about that, we often sort of refer to what we've called the risk cup. So sort of what are the things that are unique to you and your family? So where is your home located? Are you near an interstate or freeway? Are you near industry, like a, toxic waste dump, or some other kind of industry that is creating pollution or contamination? What kinds of things do you eat or drink? Do you eat a lot of processed food, or do you eat organic foods? Do you drink alcohol? Do you have a habit of putting your fingers in your mouth? Other cultural factors, the foods we eat, the beliefs that we have, the practices, beauty routines, all of those can impact how much we're exposed. Do you smoke, or are you around smokers? We know that cigarette smoke is very toxic. Is your housing healthy? So are you exposed to asbestos in your home, or mold, or chipping, peeling paint? Do you go to the doctor regularly? Do you have good preventive health care? And what is your family's disease history? Do you have a genetic predisposition to illness, or are immune compromised? And what is your stress level? Our stress has a big part in how we, just how our body functions. Having high cortisol levels or high stress hormones can exacerbate toxic exposures. And how often do you damp, dust, and mop and vacuum in your home? The damp, dusting, and mopping is a great way to get any dust that might have residual chemicals or toxics in it. So all of these things impact whether we, how much exposure we're getting from toxics in our daily life. So why do we focus on children? So children are at greater risk from toxic exposures. They breathe and eat more for their body size. So that is a big part of it. And they are still growing and developing. So their cells are rapidly dividing and replicating, and so that's an opportunity for more impact. And then just their behaviors, right? They put dirty toys and hands in their mouth. So that can put them at greater risk. And they spend more time closer to the ground. So kids are crawling on the ground, on carpet, on floors. They're closer to the dust, and especially, if there's a house where there might be lead or arsenic in the soil, and that gets tracked into the house, then if the kids are crawling through that, or then they'd be more likely to have exposure. So how do exposure to toxics affect our health? So effects can be profound, or they can be subtle, and they may not appear right away. So some diseases like diabetes, cancer, and asthma can take years to develop, or they may develop quickly. Learning disabilities and IQ deficits can be noticed quickly after exposures to some pesticides or to lead sometimes, and I know there are folks in the room that know a lot about early childhood development. Sometimes you may not see the developmental delays until later. Like you probably aren't going to know with a 6-month-old, maybe whether there's a delay, but by the time they're 2, it's going to be pretty obvious that there are speech and other developmental delays. Or behavior issues, so being aggressive or withdrawn. A lot of kids that have issues with impulse control, aggression, that's going to show up later and maybe not right away. Exposure to toxics can have effects in people's ability to have children. And of course, that's not going to show up until later too, but it could be because of exposures to toxics early in their life. And allergies and sensitivities can happen quickly or could be cumulative. Where it's just a while for somebody to show that they have those sensitivities. So lead is one chemical that we can clearly link to very bad health effects. We'll be talking primarily about lead, but who is the most impacted by toxic exposures? So unfortunately, poisoning disproportionately affects children of color because of the greater likelihood of living near toxic waste dumps. I mean, the whole systemic racism, the more likelihood of being housing that isn't maintained because of landlords that aren't doing the right thing. So communities of color have higher exposure to air pollution than white non-Hispanic counterparts. Often, I don't know if you've ever seen old stories about like where if a city is going to put an interstate or a highway through a town, it's often through the lowest income parts of the town. So even if people didn't choose a home near a highway, that often ends up happening later, or that industrial truck routes are designated through low-income communities. Water contamination in low-income areas and communities of color across the nation because of deteriorating infrastructure. Communities where there isn't a large tax base, and so they are not maintaining, the cities aren't maintaining the deteriorating infrastructure. I think we've all heard about Flint, Michigan, and the lead poisoning that happened to the communities there because of deteriorating infrastructure. Landfills, hazardous waste sites, and other industrial facilities are most often located in communities of color. So we always frame this conversation around issues of environmental justice, and it's no accident that these are the outcomes that we see. So lead occurs naturally in the Earth's crust, metal. It is tasteless and odorless. And the way that lead most commonly enters the body, so breathing dust containing lead, eating or drinking liquids containing lead, and putting hands in mouth after touching items containing lead or covered in lead dust. So I always have a hard time remembering when leaded gasoline was banned in the United States. I don't think it was until the 90s, but I'm 59. I'm pretty sure I grew up breathing lead because of all of the exhaust from cars burning leaded gasoline. And in fact, some small airplanes and other, I don't know how big the airplanes need to be, but they still use leaded gasoline. but of course our cars don't anymore. So the health effects of lead poisoning, there really is no safe level of lead. There is damage to the brain and nervous system, and if a child has too much lead, it can be fatal. We have not had a lead poisoning fatality in this state for a long time, but they are still happening around the country. It slows growth and development. We can attribute learning and behavior problems to lead poisoned children and hearing and speech problems. I was talking to a pediatrician just last week who identified a lead poisoned child because of a speech delay. Lead poisoning can cause lower IQ, decreased ability to pay attention, and underperformance in school. So it really is a very problematic chemical. And even at very low levels, lead can impact kids and the way that they learn and interact with others. So this chart, you can see from the this is measured in micrograms per deciliter. So it's a very small amount of lead that can cause problems. So under 5 micrograms per deciliter is still not, we really don't want our kids to have any lead at all, but this is where you can start to see more developmental toxicity and going up the level here to about 150, which is where we would see death in children. But you can see all the other problems along the way: anemia, encephalopathy, of these issues that happen. This 5 micrograms per deciliter is where a case investigation is initiated. So right now, if a child tests for lead and their level is below 5, the pediatrician would likely talk to the family, but there would not be an investigation to try to find the source. We would like to see that lower, but right now our case investigators are pretty much at capacity because of all of the new refugees from Afghanistan, and many of those children are coming with lead poisoning because of it. In Afghanistan, they still use leaded gas, and there are some other environmental exposures that we could talk a little bit more about later, but 5 is really where 5 and above is where we sort of see the system activating and coming in to investigate and figure out where the child is getting exposed. So primarily in King County, I know the article about turmeric was really alarming, but still in King County, the primary source of lead exposure is lead-based paint. And so more than half of housing units in King County could contain lead-based paint. And it can be on the exterior, around the windows, the baseboard, or it can be inside. It could also be like the paint that you would see on metal, like on a railing. And so some non-paint lead exposure sources: older plumbing fixtures, bare soil, so especially in areas that are close to airports or highways, or in South King County that are in the smelter plume area. Hobbies, so this picture is lead fishing weights. So I have read about kids being poisoned fatally from swallowing lead fishing weights. And the hobbies like stained glass. And I don't know if anyone remembers, a few years ago, there was some lead poisoning that happened at a shooting range in Bellevue. some of the folks that worked at the shooting range were exposed to lead from the ammunition from working at the shooting range and brought it home to the family on their clothes. Other workplace exposures, folks that work in battery manufacturing, again, gun ranges or bridge painting, they could potentially be exposed and bring it home to their families and be exposed themselves. Some other non-paint lead exposure sources. So traditional products, Surma, coal, Greta. We see imported candies, that have lead, especially from Mexico, is what we've seen. Hand carried spices from outside the US, which is what the NPR article talked about. Pottery and ceramics. And that can be, this picture is of what looks like Mexican pottery, but it could be pottery from just about anywhere, or ceramics from just about anywhere. The lead is in the glaze. And so that is always a concern. Personal care products, like there's a skin lightening cream that has been found to have lead. Again, we talked about the coal and Surma, the cosmetics that folks use, and we'll go into a little more detail about that. But we're also finding lead in aluminum cookware. And this is a little bit of a new finding, and we're really working to learn more about the extent of the issue. But our team in hazardous waste purchased some pots, just some cooking pots from some stores, and they tested very high for lead. It's always aluminum. Stainless steel is very safe. We did not find any stainless steel cookware that had lead in it, but aluminum cookware is potentially a big problem, and we'll talk a little bit more about that too, about like what you can do. So we did talk a little bit about the story on NPR about turmeric. It's not clear to us how much turmeric that is available in the United States, or spices in general. It doesn't have to be turmeric, but turmeric seems to be a big offender. How much that's bought and sold in the United States is contaminated. The cases that were discussed in this story were all spices that were hand carried, brought from India by the family. So it's an interesting story. And I know it's very upsetting to think. I think when I talked to this pediatrician, she shared that the grandmother grew the turmeric and grew it herself, and because she was worried about contamination. And so it's a very sad and so really the only way to know for sure whether you or your children have been exposed is to do a blood lead test. And we are working with providers in King County to try to increase the amount of testing, because we really don't test enough children. And so the way that it was being done is by a finger prick and a little capillary test. It could be done in the doctor's office, but there have been some problems with those machines. There was a big recall of the machines that do the test in the doctor's office. So now pretty much kids that are being tested have to be tested through a venous draw, or like when you get a blood draw, which is, it's hard for small kids, but it's really the only way to know for sure. And there are times within regular well child checks that they do a blood draw. I think around 1 year they usually do it to test for anemia, some other things. That's a great time to get tested because they're already doing the blood test anyway, and so you're not subjecting the child to another blood draw. And hopefully soon they will come up with the capillary test, the finger poke test that is more accurate. I know the company that did the recall is working on improving their product, hopefully. So you can see we are not doing very well with testing. Compared to other states, we're one of the lowest in the country. And while it is a requirement that all Medicaid eligible children are tested at 12 and 20, only testing even about 13% of those. So that's why, like Dr. Amish, that's why he's so passionate about this, because providers really need to talk to each other about the importance of this. We actually did a survey a few years ago to ask providers why they weren't testing. And what we heard mostly was that they don't believe their patients are at risk, or they are not familiar with the guidelines, especially around Medicaid. So we have worked really hard to try to educate providers about the importance of testing. At the same time, we try to about the importance of testing. So we take, two different tracks. We want medical providers to initiate the testing. We want medical providers to bring it up with families, but we also want to make sure that parents are aware, so that if they have a provider that is not sort of, with the program, that they can say, I want my child tested. And this is why, like, it's important. I want you to test my child.
So Amy, what about insurance?
Yes.
Is it covered by insurance?
Yes.
Do this test, so then that way more parents will be able to, the idea here was to just get them aware of it so that they can ask their providers to, because the turmeric is such a big alarm in my community.
Yes. I can imagine. Yeah.
Yeah. So yeah, if insurance covers it, I don't think parents will mind poking their kids just once. Thank you.
Yeah. Yes, and certainly if parents are, if their kids are on Medicaid, or Apple Health is what they often know it as, it definitely covers it. So the latest numbers that the Department of Health has, so back in 2018, there were, in King County, there were 154,243 children under 5 years old. And of those, only 6,749 were tested. But of those tested, we had 216 that had an elevated blood lead level. So I think that's about 3%. So you can imagine how many kids we are not finding who have elevated blood lead. So we just want to talk a little bit about what we can do at home. I don't like to just provide a bunch of, doom and gloom and scary information. There's a lot that we can do to protect our kids and ourselves. So around lead-based paint, one of the best things to do with kids is to wash their hands all the time, as much as possible. And of course, keep them away from peeling or chipping paint and any chewable surfaces with lead-based paint. Use a damp cloth to wipe down surfaces to remove dust. So just to back up a little bit, like, even if you live in an older home, and there could be old paint around the window. Even if it's not chipping or peeling, just the action of raising and lowering the window can create a fine dust that would contain the lead paint. So that's why it's really important to use a damp cloth to wipe down surfaces. So especially the windowsills, if you have an older home that could potentially have lead paint. Placing a blanket or rug on the floor where kids play, and then permanently removing lead hazards by hiring a certified lead abatement contractor. This is not a job. This is not a do-it-yourself job. Families should not try to remove lead paint themselves. People have to be trained to do it safely. It's certainly okay to paint over chipping or peeling paint, that is fine, but to remove it can often distribute even more lead into the home. So it has to be done safely. The other thing, and I'm trying to remember if it's later in the presentation, but just in case, so lead paint can be on the exterior of a home as well, and that paint can chip off and go into the soil. So if you live in an older home, play areas in the yard, you want to make sure that you're either covering with grass or wood chips or something, just so kids are not playing in bare dirt in their, in the home. Oh, this is where it is. So for contaminated soil, you want to make sure to use a doormat, a really good doormat, and wipe or remove shoes before entering the house. Removing shoes is a huge benefit. It's a great way to prevent tracking contaminated soil into the house. Limiting soil exposure. Again, this is, if you have an older home, it's pretty easy to get your soil tested. There are, there are some things that are sort of more expensive to do, but getting a soil test is not a hugely expensive thing. But if you're concerned, if you are in a house that's older and you want to get it tested. So again, cover bare soil with grass, plants, gravel, or wood chips. And try not to let kids play near the walls of the house or garage where the majority of the paint would be chipping, and then make sure that they are playing in grassy areas. So cleaning tips, again, damp dusting and mopping. HEPA vacuums can help with so that you're not like sucking up dust and then spewing it back out into the air. Make sure to look for any peeling paint throughout your house. And again, don't repair or disturb without using a certified person. And HEPA air filters can be really helpful too. There's been a lot in the news about HEPA air filters and how great they have been to help reduce the spread of COVID. So there are lots of benefits to HEPA air filters in the home, and lead is one. So improving indoor air quality, so other toxics. We can reduce our exposure to carbon monoxide, eliminate mold, and monitor radon levels too to prevent toxics. Increasing ventilation, opening windows whenever possible. Not recommended if you live right next to like a highway where there is a lot of truck traffic, but if you're if you have healthy air around your house, increasing ventilation is good, and making sure to frequently change the filters in your heating and air conditioning system. I know I asked after the was it last summer? No, not this last summer, but the summer before, when our air quality was so bad because of the wildfire smoke. I realized that I had not changed the filter in our air conditioning system, and it was terrible. And I think especially now with the summers with these smoke events that we've having, it's really critical to change your filters frequently. Pest management. So we do not want to use pesticides in the home, especially with small kids. So there are lots of tips for, managing the presence of ants and roaches. And we just don't want to use pesticides unless it's a last resort. Making sure to keep food contained, just all the basics about pest control. Toys and play areas. So old toys, especially old plastic toys, can contain lead, and some toy jewelry can contain lead that can have risk to children. So if you have old toys, and I know sometimes families like to pass toys on, but if it's an old toy, I would probably just put it away for just to look at, but definitely to make sure that kids aren't putting them in their mouth. And then make sure that you're shopping for lead free, non-toxic toys, and these types of seals on the products are important. Avoid any soft plastic or vinyl toys. They can have toxic chemicals in them. Wash them often and make sure to check for recalls and safety news. There was also a story a couple years ago about kids' back to school products like pencil pouches and backpacks that had high levels of lead and arsenic in them that were being sold on Amazon. And the state attorney general's office has really tried to crack down on Amazon to make sure that they are assuring that the children's products that they're selling meet these requirements for to be non-toxic. But I'm sure you know what a complicated marketplace Amazon is, and all of the different places that we are now buying products. It can be really challenging to make sure that things are safe, but to look for these seals of approval is more important than ever. Toys and play areas, you just want to make sure that that the areas where kids are spending time are as free as possible from toxics. And obviously we don't want play areas next to high car traffic and fumes and exhaust. And it's funny, a couple years ago in Seattle, we worked with the Seattle Parks Department. There was a renovation happening at one of the community centers, and they were gonna put new playground equipment, like replace the old playground equipment. But the playground at this community center was right next to Highway 99, like really close to Highway 99. And so we did a health impact assessment and worked with them to actually, instead of putting new playground equipment in the old site of the playground, to move the playground away from Highway 99 and at a different portion of the property. Because even moving, another 100 feet or 200 feet away from the highway can make a big difference. So it's sort of crazy, I think, sometimes how people decide where playgrounds and parks are going to go. Yeah, next to highways is not a good location. So always when coming inside from playing, kids need to wash their hands. And again, we talked about taking shoes off too. Avoid heating foods in plastic. I think a lot of times we just think about putting something in the microwave right in the plastic container, but as much as possible, avoid that. Hand painted dishes and cookware is beautiful, but really should be more to look at or to display, maybe not the food that we're eating, unless you've had it tested. Make sure that you wash your hands before you eat. It's just some basics, especially for our kids. And as healthy of a diet as we all can have can help our bodies deal with the pesticides and toxic exposures that we just get every day, whether we want to or not. So I talked a little bit about the metal, that's the aluminum cookware. And I know it's difficult, like if you have a full set of aluminum cookware, if that's what you use, and you can't just immediately go out and replace it with stainless steel, make sure that you're not storing the food in the aluminum cookware. So after you've cooked the food, make sure to take it out and store it in a glass or plastic container. Because we have found that a lot of the families where we were doing the case investigation for lead poisoning were storing the food in the aluminum cookware, and so that can cause additional leaching of the lead into the food. So again, resources for families. There isn't a safe level of lead, but we do start case investigations when the levels are 5 micrograms per deciliter or above. So just know that if you are going to get your kid tested, to sort of know what would happen if they did test with elevated blood lead. So the results get sent from the doctor's office to the Department of Health in Olympia. And then we get the referrals at our King County Public Health Department for any of those kids that have lead poisoning. So they would then get an investigation, which is just somebody who's trained as a lead inspector to come into the home and talk to the family and try to find that exposure source. And they're very good at what they do. They're very compassionate. It's scary for families. I know a lot of parents feel guilty that they have, inadvertently exposed their kid to lead. It's very emotional. But the most important thing is to find whatever that source is and make sure that it's not part of the kid's environment anymore. And then, then you can also prevent additional exposure of younger siblings or parents, or, pregnant moms. It's just really important to get that source out of the home. And it's not always really straightforward. Sometimes it takes more than one visit. Like we might go into a home and think that we think that it's the spices, not sure, but and then the child is retested and the lead level hasn't come down. And so then it's clear that we didn't figure it out the first time. And so then it just takes more sort of communication with the family to try to find out what it is.
So is there any a time that you advise families? So for example, if you're eating some spices and we found that the child has a high level of lead due to those ingredients, how long should a family wait to test it again after they stop eating that particular product?
That is a good question for a pediatrician, but I would think the lead level should come down within a couple of weeks.
Okay.
It should be pretty quickly that we see a decrease.
Okay.
I would think they would probably wait a month before they would test again, but I think that would just need to be a question with the pediatrician, and it may depend on how high the blood levels are as to how aggressively they want to retest.
So I have a couple of questions, and there are a couple of questions in the chat box that I would like to go ahead and address before people start leaving. So I wanted to say, are there any off-the-shelf products we should avoid, or do you know the Indian spices like turmeric, basic chili powder, and garam masala, and all those spices? Which brands to avoid, or which brands to avoid? Do we know that from
Well,
FDA?
we have not, we don't in the public health department, but I did see there was a Consumer Reports article from November 2021 that somebody just shared with me that does share some brands to avoid.
Would you please share that with me over the email so I can share
Yeah,
that?
absolutely.
Yeah, that would be really helpful for families to at least know and avoid what is FDA approved list of spices to avoid,
Right.
because we know all the lead-based paints and stuff like that, but we really don't know the Indian spices because it particularly affects my community, Indian community. Nowadays, more and more other communities are using Indian spices, but for that person. And I also had a very important question to ask from our culture point of view and from my community's point of view is we burn a lot of incense in our houses, as a religious offerings to on festivals and on a regular daily basis. And those incense are burned at home on everyday basis. And so do you know anything about that, which incense to avoid or what effect of that smoke and of that incense burning thing affects affects families? Do you know any of that, or candles, for example?
I don't know. With candles, I think it's more an issue of the fragrance, and fragrance can have, can be toxic. With incense, I don't have, I don't know about lead. I would imagine it's possible, and I would be happy to follow up with you. I can ask our toxicologist about incense.
So what about pregnant moms eating spices? Do they also need to take the precautions or take the
Yes.
lead toxicity level?
Yes. If pregnant moms should definitely ask their providers for a test, for a lead test. Lead can pass from mom to baby and through breast milk. So yes, we definitely want to test pregnant moms for lead, definitely.
So somebody asked how safe it is to buy homes built before 1978.
Well, I think a lot has to do with how well it's been maintained. So you would definitely want to look at the condition of the paint. I know I live in a, or did live in a house that was built in 1908, but the windows had all been replaced. And so the, all the wood around the windows had been replaced. So there was no chipping or peeling old paint. Now on the exterior, I think there was. And that's a good, again, a good, but there are things you can do like not wearing shoes in the house and limiting soil exposure. But I don't think
Actually,
I would not make a blanket statement that it's not safe to live in older homes.
yeah,
I wouldn't say that.
actually, not wearing shoes is in our culture. We do not wear same shoes at home. If at all we wear shoes, we have different home shoes at home. So because it's in our culture, we don't wear outside shoes.
Very wise.
So that shouldn't be a problem. But a lot of moms are asking like, um, how can we I think you talked about briefly on what can we do on everyday basis to decrease the effectiveness of lead toxicity with children, like avoid paint-based toys, avoid wearing shoes, wash hands regularly and frequently, avoid soiled rugs and carpets, change your air filters and things like that. Are there any cosmetics that you know off of hand on top of your head, or FDA approved, non-approved, like nail polish, like, young girls starting at 4 years old, they love to wear nail polishes on their fingertips and on their things. So are there any no nail polishes brandings or any names that you are aware of?
Well, I know like at, PCC, Whole Foods, they do sell lines that don't have the most toxic, like toluene. And I would love to have our toxicologist here, but you definitely can do a Google search about those. So there are nail polishes that are safer. And I would definitely recommend, if especially young kids want to wear nail polish, to choose those less toxic brands. And we also know that we talked about some of the cosmetics, some of the cultural products, and generally those are brought from other countries, but hennas can have lead in them. It's really important.
Oh, really? I didn't know that. Wow.
Yeah,
Because henna is so prevalent and we use it on every festivals, and
yeah.
young girls, moms, everybody uses henna on their hand, and they can be contaminated. Oh, wow. I didn't know that. Because
Yeah,
I thought
so
it's
I
such a
would do search for lead-free henna.
And hair color, is hair color
Can
also?
be. I don't think that hair color bought in the United States would have lead in it. But there certainly are, there's a range of products in terms of the amount of chemicals that they have. And there are some companies that have done, some nonprofits that even have apps for your phone where you can put product names in, and it will sort of tell you how safe, how toxic the brand is. And I can follow up with you about some of those,
Yeah, that would
especially
be,
cosmetics.
yeah, that would be really helpful. So then I can share it with my
Mm-hmm.
moms on the
Yeah.
following next Thursday, that these are the products and these are the things, and this is the app that you can upload on your phone, because phone is such a
Yeah.
intricate part of our life. I don't think I can live
Yes.
even 1 hour without it. So that would be very, very helpful.
I did
Um,
want to share really quickly, though, just that one of the things that happens when a child gets diagnosed with elevated blood lead is that they can automatically qualify for developmental services. So it's just really important to give hope to parents that if their child has an elevated blood lead, it is not doom and gloom. They are not, for sure going to have terrible effects, that there's a lot that we can do. Their brains are changing and growing all the time. And so getting those really important developmental services can make a big difference, so that we can work on the speech delays. We can work on the other, any delays that have happened. So there's just a lot of hope. Again, it's
would you,
just important to remove the source of lead and then get the developmental services that they need.
that
And
is
those are also covered by insurance. Yeah.
Yeah, that is very helpful. There's another question in the chat box saying, is there a way to find out from the ingredients list that they have lead or not? Is there like specific term, or is there specific chemical uh, word that we should be looking for?
No, it's always a stealthy kind of thing. And I think one of the reasons why it's used, especially in turmeric and other spices, is because it gives it that bright yellow color that people are looking for. The lead chromate has a bright yellow color. So it's a way to disguise a poor quality spice. And the other thing is that it's heavy. And so because spices are often sold by weight, that you can slip some lead in there and make it heavier. And so it's cheaper to put lead in than to sell, than to give the customer all of the spice.
So if
So
I
they're
read,
not going to tell you that it's in there.
no, but if I read on the ingredients lead chromate, then I should avoid that turmeric. Is that how?
But they would not put that in the, because then you would know, it's like, oh, why, poor quality. So.
Why, even in the cosmetics, they wouldn't put that?
No.
Oh, that is so sneaky. That is so sad.
Yeah.
And FDAs don't require them to put that thing in there. That is because the level they add is very low.
Well, and I think for the cosmetics that we have seen, like the Kohl and the Surma, they're not produced here in the United States.
Right.
And so they're not regularly checked, or often people will, that own a small store, selling ethnic products, cultural products, they will do it themselves. Like they'll have like a contact in their home country ship things over. So it's not going through the regular process. I mean, we've heard about some things that people keep behind the counter that you have to ask for because they don't want to put it on the shelves.
Oh, wow. So, yeah, I know that nowadays surma and the kajal, that is, people don't use it as often. They've gone to using the eyeliner and whatever of the pencils.
Yeah.
But yeah, surma used to be a very toxic thing that people used to use in their eyes before that, I know for sure.
Yeah, it's still being used. Yeah.
Is it? Oh, wow. Okay.
Do we have until 12:30 or just until 12? We do. We have until 12:30.
Yeah, we have it until 12:30. But
Okay.
I think there were a lot of questions and I just wanted to break up the monotony. So that's why I asked.
Okay. Okay.
Sorry.
No, it's okay. I'm happy to answer questions. Let me just see. Yeah, let's go through questions and then, yeah.
Yeah. So how about finger painting? Finger paints for children?
Should be fine as long as, so make sure to check if when you're purchasing those finger paints, just make sure to check for that label that it meets the, because kids art products should all meet those that are bought here should all meet those standards. It should be fine.
I see. And what is, we say kajal or eyeliners. Are there any products that have lead? I know you have said this before, but I'm just reading the questions from the moms from the chat box. Like a lot of moms here, they put this thing called kajal. It's similar to surma, but not exactly. It's not wet, so it's like a paste thing that comes in a small container, and then the moms put that in their hands. So I'm not sure how safe is that. So one of the moms is asking about that.
If it's not, I would say if you buy an eyeliner or some eyeshadow at the, at the drugstore, it should be fine. But anything that is imported that is labeled as Surma or Kajal, I would not use.
Okay, ladies, so no kajal for your kids. Doesn't matter how their eyes are, okay? And just by putting kajal, their eyes are not going to be bigger. They can use the eyeliners that are safe, but please do not put or use kajal. I know it's very prevalent in Maharashtra and South India to use this kajal in the children's eye. And there is a saying that, oh, their eyes will get bigger. There is no such thing. I think that's a total myth.
But Suchita, sometimes they make kajal at home and then they apply. So what do you think about those?
Yeah, so it depends again pure. on the kajal is usually used by ghee, like burning the ghee and then using that soot. So I'm not sure if that soot is okay to use for child in their eyes. I mean, after all, it is not good for you. Any product that is from outside, and I think this is a physician's and pediatrician's question, but I would not put that in my child's eye, even though if it is homemade. Okay.
And how about
what is Well, it depends on where you're getting the spices from. So if you're buying turmeric at the grocery store and drying it and grinding it yourself, it should be fine as long as whatever you're using to grind it with is safe, because they think that sometimes that's the source of lead in spices, is what people are using to grind it with, the metal, the metal mechanisms that are the grinders. It could be have lead dust coming off of them, that could be a problem too.
They could be old, and another mom asked, can we use steel pots with some black spots inside because of long-term use in them? So is that a problem? Like, is that a...
If it's stainless steel, I don't think it's a problem.
Right. And what about iron parts that are being used over and over again? Like, do they...
I haven't heard about lead in iron pots, like like the cast iron pans. I haven't ever heard of lead in cast iron pans.
Yeah. And Brahmara, if you're using the steel pot that has black spots inside, just take a steel wool and clean it really well. Steel wool really, really helps clean those steel pots that have a lot of black spots inside. And I'll share a picture of that steel wool with you.
And then also make sure, as I said, not to store food in those pots, to transfer it to glass or plastic, to put it in the refrigerator and store it.
Right. Yeah, I think I've asked all the questions that were there in the chat box, but if you want to keep going with a couple more slides, I think we have time.
Yeah. So. Okay. Yeah. So what we continue to do is to try to build knowledge and awareness with both families and doctors. And we have, before COVID, we had a lot of community events, and we would actually do lead testing at community events, and we did product testing as well. There's a machine that we have called an XRF machine that can detect lead and arsenic and other things in products, and we would do that at community events, so people could bring their spices or bring their pots or bring whatever they wanted, and we would test it.
Oh, that must be awesome.
Because of COVID, yeah, but because of COVID we haven't, but we do have a plan to start that again this year.
Oh, that would be
I
awesome.
will be
get in touch with me.
I will be in touch. Yes.
Yeah, we will bring all our spices.
Yeah, if you wanted to host an event this summer where we could do it outside and people could bring things, we could absolutely do that.
Oh, that would be awesome. We would look forward to that, because I'm so worried about this.
I know, but you just don't. Yeah. Well, I think tested. That is the thing. And I actually
do is to avoid all of this is we can just get a couple of brand name spices and test those, and then we can ask community to just those products are safe, because yeah, that would be an awesome event, I think, and it would help the community at large so much. I would really highly appreciate that event outside. Yeah. In the summer.
And we do, we have created a lot of education materials. We have this little illustration developed and it's translated into 21 languages now. And we have videos as well. And so we try to get as much information as we can out to the community.
Yeah, so you can share those videos with us, and it would be cool to share it with our community, and not just with our moms, but we have senior program, we have a young adult program, and we have so many different programs that we can share those videos, because it's not just about the children, it's also about the other communities that is here that we are providing our services to, right? So that would be awesome to share those videos with them.
Yeah.
Yeah.
We continue to educate medical providers too. Like I think it's a shared responsibility, right, between the doctor and the family to get kids tested. Ideally, providers are initiating the test, but parents have to consent to it too. So, so we did a continuing medical education course for providers that Dr. Dave helped with, and we just keep trying to reach out to providers. So, folks are welcome to email me. We can follow up if there are questions that come up afterwards. Happy to follow up.
Yeah.
And I will follow up on the incense issue for sure.
Right. Yeah, that would be really, really great. And also the products, you said you have a list of products that we should.
Oh, the article in Consumer Report. Yes, I will do that.
Yes, I would. Does anybody have any questions, guys? I would be happy to. And if you cannot speak English, please, I would be your. Amy, if you can stop sharing your screen, then I can have everybody looking at it. What if our house?
I'm just trying to remember if I
Hello?
Yeah. I'm here. Sorry.
I cannot. Yeah. Anybody has
me?
Yeah, now I can hear you. I couldn't hear you. Does anybody have any questions?
Oh, I see a couple in here now. I can see chat. Okay. Non-stick pans that I know of do not have lead, but there could be other chemicals in non-stick pans. So with non-stick pans, you want to make sure that you're not that you're always using the plastic utensils. So make sure to check your pans, make sure it's not, that the coating isn't flaking or coming off. If they start to deteriorate, then you toss them and get a new one. You don't want you don't want to be using it if it's scratched or flaking.
Right. What
the
if you're
solid waste management center? I don't think so. I think you would just, I think, want to do the regular, like making sure that you are changing your any filters in your heating system regularly, but I have not heard of any issues for the solid waste management center.
Right.
And yes, we can arrange to test some samples of turmeric.
Yeah, we will do that during the summer, okay? Whoever is this Yogesh's Galaxy, we can arrange to test some samples of turmeric in the summertime when it is nice outside, so that we can all do it outdoors. Any trusted source or brand of turmeric? I have asked that question before, I guess, but I think you don't have a good answer to that question.
Let me hold on one second.
Okay.
Because the article in Consumer Reports, let's see. So this just was in November.
Right. I read that.
Let me find turmeric. Curry powder was pretty good. Where's the turmeric? Lakshmi brand was good.
Lakshmi brand is good. Okay, good to know.
Spice Islands was good.
Oh, I haven't heard that one.
Sadaf.
Huh? Can you spell it?
Sadaf, S-A-D-A-F.
Oh, Sadaf. Okay, that is a Mediterranean brand, I think.
Simply Organic, and Badia, B-A-D-I-A.
Badia. Oh.
Badia was good. The ones that they said were not Kirkland signature, what you get at Costco.
Oh, wow. Somebody asked that Kirkland signature was not good. Okay.
Nope. Morton and Bassett, McCormick, and La Fleur. Actually, La Fleur got 3 red dots, like really bad.
Morton and what? Morton and?
Bassett.
B-A-S-I-T.
B-A-S-S-E-T-T.
B-A-S-S-E-T-T. Can you also just email me all these things so I can just forward it? And it's
Happy to.
Yeah, it'll be easier to just have it in the whole Indian community so that way people will buy it. So Lakshmi was good, Spice Island was good, Sadaf was good, Simply Organic and Badia were good. Kirkland signature not good, Morton and Bassett not good, and La Fleur was not good. Okay.
And McCormick.
And McCormick, wow, that is amazing. McCormick.
Yeah.
Was not good.
And Amy, how about the loose ones we get at PCC and Whole Foods? Are they good, the organic masalas?
They do not list bulk from any of those places. I think they just tested
Kavita, can you quickly type these in the chat box also so that people can do it?
Yeah.
So Lakshmi, Spice Island, Sadaf, Simply Organic, and Badia. They were good. I use Lakshmi all the time, so I'm good.
And curry powder, they all tested okay. And I think it's so interesting because I know most curry powder has turmeric in it.
Yeah,
but the McCormick tested fine for curry powder, but not for turmeric.
So you see, in Indian spices, we don't use curry powder. There is no such thing as curry powder. We don't use that, but we use garam masala, which may have some form of turmeric. So when we have that open summertime, the testing thing, we will bring some garam masala products also. So that way, and coriander powders and different powders that we use so that we can test the lead toxicity in them.
Yeah, so this article they tested dried basil, black pepper, chili powder, coriander, cumin, curry powder, garlic powder, ginger, oregano, paprika, saffron, sesame seeds, thyme, turmeric, and white pepper. Those are the spices they tested.
I see. Of these, all these brands?
Yes, they did. They didn't do the same brands for each. Like, for example, in the coriander, they tested Penzeys spices, which I did not see in the list of turmeric. But they did do Lakshmi brand and Badia and Simply Organic and Morton and Bassett. So, and cumin, they did Whole Foods, which tested fine for ground cumin.
Oh, I see. Ground cumin.
Trader Joe's organic ground cumin did not test well.
Oh, wow. Really?
Yeah. So there's a lot on this list. So I will
just email
I will send it to you.
Yeah, that would be awesome. So I can share it with my community, and it would be so helpful for all of us to know how to avoid and where to avoid, basically, because we are consuming them daily, and without knowing it, we are just putting them in our body.
I know.
And that is just shocking. I, as an early childhood educator, I'm finding it so heartbreaking that things that we are eating and feeding our children are making them in speech delay and in focus problems and in all of these things without our knowledge. And that is just very, very heartbreaking. Because
I agree.
yeah. And I wish I had done this talk earlier. Now I'm going to make it a point to have you every year or every 6 months so that whoever has missed it, we can get educated and talk about it. And I also would like to invite you guys when we do our doctors, Kunjan, we do that. When do we do the?
Yeah, we do the health fair twice a year. So probably we can invite you there.
To just have big posters, and if parents have any questions, so we can have you there during our health fair to avoid all of these things and which things to get, so that way. And it's not like we are saying Lakshmi brand or any Spice Island or Sada brand is giving us any commission or anything, but they're doing a good job of putting this. Kavita, you want to say something?
I just had a quick question, Amy. You had mentioned that with soil, when the kids are playing outside and being a part of playing outside, cover it up with wood chips or grass and everything. What would you say about the vegetables then that we get when we're talking about growing vegetables in that same soil? So the vegetables, fruits, and everything that's grown in the soil, how should we be looking at it? And is there any kind of should we be aware of something while we are choosing our vegetables and fruit?
Well, I think if you're growing them at home, you might want to just do a soil test, especially if you are on a piece of property that has a if it's a newer home, I wouldn't worry so much about it. Mostly, I think just washing the vegetables really well is fine. And like if you're growing carrots, then peeling them before before cooking them or eating. There are, for the folks that live in the smelter plume area where that the levels of arsenic and lead are high, what they suggest is doing raised beds and bringing soil in to grow vegetables in. But that's specifically that is known to have high contamination levels. And that's an area in South King County, like around Bay, and even Federal Way they don't have the levels like they do in parts of Pierce County and parts of Tacoma.
So we talked so much
really
about
high
food.
levels.
We talked so much about food, but what would we do to avoid water? Like, I test water here in my house in King, I live in Bellevue, and that is an amazing, great quality water. But
we do have good water.
But my daughter lives in Auburn, and when I test her water, and it's not the same taste. And I tell her, oh, I don't. And she says, Mom, why are you drinking tap water? Drink from the filter. So is there something people living outside King County? Or I have a lot of community members living in Bothell, Redmond, Kirkland, Linwood, all those areas.
Well, I think in general, all of the public water in our area is very good. We have really good quality drinking water. The issue would be if people are on a well system, if they're out in rural areas, or if their own pipes are old. So it's not about the city's water, it's about their own, the pipes in their own home. So if you live in an old home and you're concerned about your water quality, one thing you can do is just run the water for a minute in the morning before you drink the water or before you cook with the water. Just run the water for a minute so that all the water that's been sitting in the pipes all night just gets flushed through. That is just a really simple thing to do.
That's a great habit that my husband has taught me as soon as I came to this country. He says, as soon as you get up in the morning, we have a habit of drinking a glass of water. And he says, let the water run. And I was like, we're wasting water. We're wasting water.
He was
So
right. He was right. Darn it. He was right.
so right, like, let the water run for a little bit. Even if I've not used my sink in the prep kitchen, I let it run for a long time and then I started, because it's not the water that is sitting in there. So
Yeah, I like to wait. And I live in a newer house now. I was built in the 90s, but I like to wait till the water gets cold in the, you know,
yes,
because we have lovely water actually. And like I grew up in Florida, as I said, and our water was terrible. It tasted terrible. It was terrible. And when I moved here, I just could not believe how lovely our water is. It's cold. It comes out cold and it tastes
cold,
good.
yes,
And
yes.
yeah,
California water is not as good either. My younger daughter lives there, and it's like, why is this water warm? It's like,
I know. I know. Yeah.
On
Yeah.
that
There are a few
note,
more questions in the
Yeah.
chat box. Yeah,
Okay.
sorry, Kavita.
Sorry, before we go to that thing about the water, they used, when I came into the country, people told me don't use hot water from the tap directly because it could have a higher lead content. What's your comment on that?
That is true, but if you are living in a newer house, I would not worry about it
It's
because
again
you
about the
would not,
piping system.
because you would not have lead solder in your pipes if it's a newer house. But if you live in an old house, I think that's a great thing, is to fill, like if you're going to boil water, just fill that pot with cold water and heat it on the stove. Yeah.
Okay.
What are questions? I don't see any
Yeah,
questions.
I don't see people.
No,
I
there, Jalak is asking that whether if she buys whole turmeric from India and grind it in the grinder, can she use it and is it safe?
I would not carry any food products from India and use them here, not unless you had it tested.
Okay.
But we
Oh,
do get turmeric here in the Asian stores and the Indian stores. We get fresh turmeric, so that can be used, correct?
I think so. It would be grown here, correct? I mean,
No,
because
we don't
I
know
don't
that.
think
We
they
don't know.
would, if it's
No.
fresh, that would be,
So if it's a fresh turmeric also grows underground, right? So it's
right,
a root. So you
right.
always peel if it is fresh turmeric, okay?
Correct.
Just like
Yeah.
carrot. The rule for fruits and vegetables, if you don't know where they came from, so if it's like orange, banana, which has thick skin, you can peel it and eat it, right? But if it is grown underground, or even if it is not underground, like blueberries, strawberries and all, use organic, otherwise peel it and eat it. And that's the safest way to do it, to avoid any contact.
Yeah, I mean, that's a good question. I really don't know if fresh turmeric is imported. I would kind of doubt it, just because it's a long way to come for a fresh product. And I think there are probably other places where the stores are sourcing their fresh turmeric that are closer, like even, Mexico or California or whatever. But if anybody is sending you things from India, or if you're bringing things back when you visit, I would not do that.
Akshara, it's a simple rule. Apples, if you want to eat it with skin, buy organic. And if you
Or wash it really well.
wash it really well.
Mhm.
And if you did not buy organic, peel it and eat it. Okay. It's a simple rule for all kinds of fruits and vegetables. Wash it really well. Wash it with baking soda and vinegar and then eat it. You'd be fine. Yeah.
Mhm.
Yeah. I think this was very, very.
Well, I'm really excited about doing an event this summer.
Yes.
Yeah.
So am I. So am I. I'm really, really, and thanks for bringing that up, because I wouldn't have thought about it. And so, it would be a very successful event. I'm going to tell you from now, because the word of mouth spreads like fire in this community and everybody's going to bring their spices. We will just have a crowd control issue. But besides that, I think it would be a great event. I can just tell from now onwards.
Yeah, I know there's so many things to worry about right now with COVID and everything. And I'm really sorry that, I know turmeric is such a huge part of Indian cooking and culture, and I'm really sorry. It's a sad thing.
I see. Yeah, yeah. Well, thank you so much for your valuable knowledge and time. And I think I have learned a lot today. You know, every day I used to ask my children when they were young, what did you learn today? Just tell me one thing. And I can tell so many things I learned today. And that was really, really helpful and knowledgeable. And I promised to all my moms and myself that we will have a great event in the summer, and we will do this periodically and talk about and spread awareness in the community. Thank you so much.
You know, maybe we could talk, maybe we can do something sooner. I mean, maybe there's a way to safely have people drop off a bag of, a bag with their name on it, and we can collect things and get back to you so that, we're
That
not
would be awesome.
risking
Yeah.
COVID. So, yeah.
So Amy,
Yeah.
we are planning to start farmers market from April. So maybe one of the farmers market we can plan this event, and I think that would be a great idea.
Yeah.
Yeah.
That's a great idea.
That's an amazing thing. That would be really cool. Like, and a lot of other community members will get
Benefits out of
benefits from it too. So yeah, that's
Mhm.
amazing. Yeah, thanks, Kunjan. That is amazing. That would be a lovely event. Yeah, to have it.
Really looking forward to it.
Yes.
Yes, and thanks so much for having me. I really appreciate the opportunity to share the word and
No,
to
I
talk
would.
to you all.
Yes,
It's
and I
really
would.
a pleasure.
I would also thank Dr. Ramesh Dave because he's the one who, jerked me and said, "Hey, have you ever done this before?" And I was like, "No." So it was amazing. Thank you so much. Thanks everybody, all moms, for joining us today and making this a successful event. Thank you very much, Amy. And
Thank
we
you.
will be in touch.
All right. Bye,
Thank
everybody.
you.
Thank
Bye,
you.
everybody.
Thank
Bye-bye.
you.
We'll see you next week. Bye.
Thanks, Amy. Bye.
Thank you.
Bye.
Bye.
Bye, Kavita and Kunjan. Thank you.
Bye, Suchita. Bye-bye.